Good to have you in the studio. I mean, where do I start? The World Health Organization made it very clear that diagnosis is part and parcel of many of our problems here when it comes to blindness, at least in sub-Saharan Africa. Is it an issue of diagnosing this particular problem before it actually manifests?
Actually, in this case, it's more a case of not just diagnosing, but providing the service beyond the diagnosis. Because lots of people in Africa are getting eye exams, but they just can't afford a pair of spectacles.
So they tell you do have this particular defect, but
you got to go buy glasses.
You don't have enough money to get you back home.
Now, a lot of people, for example, when they're more than 40 years old, they know they can't see at near, they know they need a reading glasses. For you and I, we consider that 60, 70 rand that may cost at a pharmacy or something affordable and accessible, but for majority of the people, no. The studies we have done in Africa have shown that only 20% of the people who need spectacles actually get them.
So what can be done to improve that statistic? 20% is very small, I mean, considering the scale. But what can be done to ensure, I don't know, government stakeholders, other stakeholders perhaps get involved to improve the current status quo?
So I think from the government perspective, a lot of governments in Africa consider spectacles as a luxury item. So there's an import duty on that. So I think that's one place where we can start and treat it similar to drugs. I think that especially for the poorest of the poor, we need government to provide spectacles for them. And there needs to be a method to do that, because obviously if you're providing for everyone, the budgets just don't allow that. So that's a huge challenge. But from the private sector's perspective, they need to see it as an opportunity. You know, we did a study in Durban in the clothing industry where we showed that after we corrected their vision, the productivity increased by 6.5 times. So there's a financial return on this, you know. And the bigger challenge we face is we just published a study as the Brien Holden Vision Institute where we showed that by the year 2050, half of the world's population will be short-sighted. So the problem we're talking about now is going to get great because our children are spending more time on digital devices, more time indoors and less time outdoors. So there's a shift. It's a shift for the worse. And the economic impacts, the social impacts, etc., the educational impacts on children is going to be enormous.
Professor, I want to take you back on a particular point, at least the government end of things. Do you get the sense that maybe we need to have more subsidies come to play here? And I say that in retrospect, in perspective rather, to a country like Rwanda that does, for a very meager PPP that they have managed to roll out a healthcare plan for all the citizens. Now, they're not very many, but they've actually rolled this out. Do you get the sense that more needs to be done, at least on the government end, through subsidies?
Absolutely. And I think that unless you invest more, not just with subsidies, but looking at more innovative financing models, you know, there are parts of government hospitals, for example, that people with medical aid would gladly go in certain areas to get eye exams and glasses. You know, if a decent service was provided. And we've seen in some countries, and Rwanda is an example, these have become semi-sustainable at this point because they're generating an income. And there's a misnomer that our people don't want to pay. You know, we run a program with the Department of Health in KwaZulu-Natal, and we provide spectacles to all the districts. And if somebody can't afford it, we give it to them for free. But the numbers who say that they can't afford it is extremely low. It doesn't affect our budget. And we give all the kids free spectacles, and yet the project is sustainable. So people are prepared to pay some money. And I think it's also about government being committed to using delivery systems and even considering public-private partnerships to make that happen.
Another challenge in this entire issue that we're speaking about here is access. I think someone in a rural area getting access to an eye test and knowing, the current status of, their sight. How do we work around this really? And I think what's more important is the role that technology can help to assist with that particular issue.
Absolutely. I think we identified that. We started off trying to set up clinics, eye camps, etc. And we realized at the end of the day, if you don't have the human resources to do the eye exams, all the other delivery systems don't matter. You can have a $1 pair of spectacles, but if you don't have an eye exam, it doesn't work. The good news in Africa over the last couple of years, and particularly led by our organization, we've set up new schools of optometry in Mozambique, Malawi, Eritrea. There's programs in Mali, Kenya. And it's growing across the globe, where now there are nodal points where neighboring countries, people can come for training. The challenge we have is that neighboring governments need to use those facilities. So for example, a country like Swaziland, it doesn't make sense to set up a school of optometry because the population size is low. But they should negotiate scholarships there through government rather than leaving it just for people. And then when they come back, deploy them in the public sector. We've seen the example when we started working with the KZN Department of Health. There were about 3 or 4 optometrists in the public sector. And now they've got, I think, close to 50 in the public sector, and government pays for them. You know, and people in rural areas get access to an eye exam. And that, you know, so I think it is doable. It's a question of investment, you know, in proper planning, and then making sure that you recruit the human resources that you need.
We have to wrap up, unfortunately, but I can't let you go without talking about the centenary of Nelson Mandela, you as a political activist yourself. Your thoughts on his legacy and the current state of the country?
I think I'd like to say, if I say I'm not disappointed, I think we have squandered a wonderful opportunity to create greater wealth and access for our people. But at the same time, I think we should learn from his spirit and not see this as a defeat. We know that corruption is insidious. We need to address it, and we need to make sure that money gets to the people that need it. But we should use the centenary of his, the centenary celebrations to rather recommit ourselves to addressing and reversing these negative trends that are occurring in our society. And it's not a question, and we're going to focus on who to blame. I think it will be a big mistake. We should understand where the problem came from and address the issue of our leaders that have failed us. But I do think we need a very comprehensive strategy to turn this country around. We are in a very difficult situation.